Everybody, welcome to another episode of the Med List and season 2. Don, how are you today?
I'm good. I'm good. It's MLK Day today, and many of us probably had the day off.
Okay.
But I did look up one thing, Kevin, about today and what MLK said about service, thinking
Oh,
that we're talking
awesome.
today about caregivers and what about service. And MLK said everybody can be great because everybody can serve. You only need a heart full of grace and a soul generated by love. How awesome is that?
Wow.
Yeah.
Yeah, I think that the caregiving journey is interesting because the heart filled with grace gets tested really quickly, right? I mean, it's a frustrating process, Donna. I mean, the
Yes.
people that you love the most and you want the best
Mhm.
for, like
Yep.
you're being asked to take on tasks and duties that you feel very uncomfortable doing. You don't feel qualified doing, but without you, they wouldn't be able to succeed, to the level that they do. And I'm really excited to have Nicole on that understands this world so well and it can give us so many little tidbits on, you know, what can our loved ones do to better manage the medications of their loved ones, their parents, their
Yeah.
grandparents, et cetera, and also work with the rest of the care paradigm to be more successful. I know I talked about
Mhm.
bringing up on the show, but there's been a couple studies that have come out just recently, just talking about how much better patients are doing when you're talking about hospital at home versus
Mhm.
standard hospital stay. When you're going into the hospital, staying in a bed, you've got nurses and doctors and pharmacists looking over you versus being at home when you have more of a tele environment and your family looking over you.
Yeah.
Surprise, surprise, people are doing better in their own homes. But
Yeah.
what burden is that going to place on us as a society and on caregivers? We'll talk to you about
Yeah.
that in just a little bit as we get this episode rolling. All right. And I will, without further ado, Don, I'll bring Nicole on with
Yeah,
us.
absolutely. Absolutely. Welcome, Nicole.
Thank
We're
you.
just so glad to have you with us today. I'm going to do a little intro about you. And Nicole Will is joining us today. She is a dedicated advocate for the aging community. And I mean that sincerely, just doing so many things. She has 20 years of experience in aging communities, which led to your wonderful website and podcast, Will Gather. You're just full of resources, and you're able to help people navigate the caregiver's world, if you will. And I just find that it's so important that we think about how we care for the caregiver, right? It's
Mhm.
because the caregivers are putting so much into the caring of their loved ones that we hear it all the time that the caregivers don't necessarily have the time to care for themselves. But it's just having a really interesting conversation with my husband. And, we find ourselves, I am the caregiver of my mother, primary caregiver. And um, we're talking about, he says, people who don't know healthcare, don't know some of the services, they're too exhausted to look it up. And
Sure.
they spent 24/7. There's no more time where they just want to look at something else than
Totally.
caregiving info. So your information is so valuable for people so that they can, do caregiving better with good resources. So, and I'd love for you to share with us more about you and how this evolved over the past 20 years.
Yeah, thank you first for having me. I'm just so happy to be here and talk about something I think is so important, right? We're bringing all these worlds together of family caregiving, healthcare, clinicians, supporting people. So thank you for doing that. I am really bringing all my worlds together. Growing up, I was 15 years old and my grandma moved into our house. Our family actually needed to move houses to accommodate grandma moving in. So, as you can imagine, as a teenager, that was quite a change as I'm entering high school. But it was so rich and blessing of having my grandma move in, becoming one of my closest friends. She had actually lived in another state previously. So, when she moved, it was like I got to know this person like all over again in a different way, right? As a roommate, we shared a bathroom. You get to know each other very well. But there was so much blessing in that. It led to me going to college, studying gerontology, working as a director in senior living for a lot of years in a large community here in Minnesota. And I always had families come and ask me different questions about growing older, how to find care. And it really was the realization that I knew that I had access to this information by being in the profession, studying gerontology. But a lot of people don't until you're in a place where you're like, oh my gosh, what do I do? So realizing that, wanted to create a place now called Will Gather, which I'm the founder of. And it's a platform that really wants to bring all of these initiatives and resources that are happening in the care economy so that we can empower caregivers with information, tools, support, encouragement, right? So that they're not alone. We are not alone on this. And there are a lot of us that are figuring this out. A part of that Will Gather platform is the podcast, Navigating the World with Your Aging Loved One, where we interview different experts and educators and CEOs and authors and founders and caregivers and caregiver support companies that are doing really incredible work and provide their lens on what they're doing to encourage those families. And I really see growing older and aging and caring for someone, it's so holistic. So we cover so many of the different topics because it's not just one component of growing older. It encompasses so many different things, whether it's healthcare, legal documents, financial questions. How do we communicate with someone that we love? You know, I could go on and on. There's so many topics about what we navigate through. So I can back and elevate and support people. That makes me super happy. I have the best job in the whole world. I say that I get to celebrate the good work people are doing. Another part of Will Gather is being an advisory board member, consulting with various companies that are in the aging space, and creating Gigi Betty Co., which is named after my grandma. And it's a gift shop that supports caregivers not only financially, but also bringing awareness to their cause. So in all those different ways, we also am co-founder of Think Tank, which is bringing like change makers and all these thought leaders in aging services and senior living together to tackle big issues that can bring about incredible change for the greater good. So that is summed up real fast, but I'm happy to dive into anything else. But I'm just happy to be here.
Well, awesome. We're so excited to have you here. And I think there's a interesting shout out that I have to give, Nicole, that you reminded me of. You said 15 years old, which is interesting because you and my little sister, Tiffany, would have a lot to talk about. That was a really similar kind of situation when our grandma moved into the house. And hello, all of my nieces, nephews, family that I know that watch and usually complain because Uncle KK does not wave back, but I'm waving back because I love you guys. But Tiffany had an interesting thing, Nicole. She can probably still hear it in her head when she wakes up as a young mother, a cowbell that my little brother had for band that we gave to grandma when she needed something at night, that she would ring that cowbell so we could come go, around the corner. And I think there's a really special thing to becoming a caregiver at that age, that it does something to you. It softens your heart in a way that you recognize that aging process. Really going along it, Nicole, the one thing I wanted to ask you was this. How was that for your mom and dad? How was becoming caregivers for your mom?
Yeah, that's a great question. It changed a lot in our home, right? I remember having almost like a family meeting where we would communicate and talk about those dynamics. Do we want family dinner sometimes just our nuclear family, or does every dinner include grandma? Which you would think is not like a big topic of conversation, but when you have anyone a part of your family home where you're living, people change dynamic, right? Of just how you do things. So even having conversation around that, right? As we're teenagers and grandma living at the house, how do we navigate? Does grandma have, I don't know the right word to use, but like parenting rights, right? Can she tell us what to do? Can she take away the car? Like all those conversations around what does that look like? And then as grandma's health progressed, it was how do we all play a role in supporting her and her care and having her be a part of daily life. And she would come to different sporting events. It also changed dynamic with my parents in that time alone together, right? Or when you're just with your partner and you're watching TV on the couch and having someone there, which is wonderful and changes dynamic. And it also changed life for me. And I've talked about this before with my mom, and that there's a ripple effect to caregiving on, as the primary caregiver, when you're caring for someone, how it affects your children and the people in your life, right? We only have so much bandwidth, and it does take away and change relationship. And so I remember being so happy grandma was with us, loving that relationship. Of course, wanting my mom to care for her, but in some ways feeling like I missed my mom sometimes. I wanted that time with her, and I didn't have it as much as I thought that I should at that time, So a lot of dynamics shift, and we've learned so much. And when you go through things, then you can support and encourage other people when they're in that same journey. Yeah.
Nicole, you just mentioned something that I've kind of felt oppositely, where, I'm caring for my mom, and not that she lives with me, but I am the primary person who is there for whatever she needs and taking care of all the other dynamics of life that are necessary for somebody. But like the last couple of times when I've had visits from my daughter coming home and mom's been needing more of my help, it to me as the mother, I'm disappointed that I don't have enough time with my daughter. She's home visiting like at this time, and now I'm having to shift. And I've expressed that too. And we've had like lovely conversations around that. But I think it can vary as to who's missing what. And there's probably, like you're saying, that bandwidth. There are times when the caregiver is really missing what they would prefer, and I don't mean that in a bad way, but what they might prefer to be doing at that moment and what they have to tend to.
Yes, for sure. I remember being pregnant with my first child, and so here I'm having my first baby, and my great aunt, who we also cared for later in life, was having a major spinal surgery, and my mom was her primary caregiver. So those things were happening at the same time. And I remember my mom just being so sad, right? Feeling that pull, like, I want to be here for my aunt, but I want to be here for my daughter. And I just feel that I'm pulled in different directions. And it's that whole saying, which I go back to all the time, is that two things can be true at the same time. We can have immense, happiness and feel good about supporting our loved one, and be sad that we're missing out on some of those things as we have those caregiving responsibilities. So it is complex. And I think that's why the more we talk about it and shed light on all those various emotions and different scenarios that we go through, it gives us an understanding that other people are in this as well, and how did they navigate that, and what were their thoughts on it, and just even knowing that people hear us while we're sharing what we're going through it helps.
Yeah.
You know what? The one thing I love that you brought up there, Nicole, which is such a perfect comparison in life, is you mentioned your first child, right? So for everybody out there that's had a baby, there's a wild thing that there's usually a due date. It's somewhere around 9 months, and we know it's coming, right? We're
Yeah.
preparing for it. You're getting the room ready, all of these things for your first child.
Mm-hmm.
But interestingly, we all know that our parents, grandparents, aunts and uncles are getting older. We don't have that time clock that starts and it's like, well, in 9 months, Donna, you better be prepared because this is when your life is going to change.
Mm-hmm.
How, Nicole, have you seen folks be more successful with having that kind of mindset, though? You know, we can jump right into caregiving as soon as it hits us. You know, that's an option. I mean, that's an option that I pray that a lot of people can avoid, you know, that this kind of show can help.
Mm-hmm.
What are some things and tidbits that you've grabbed a hold of to say, here's some ways that we can start these conversations earlier and be more successful with our loved ones? Any top tips that you've come across over the years?
Yeah, that's a great question. And one that in all of the 160 interviews I've released, that is the underlying theme is plan ahead, right? So I love your analogy of it's so true. Like we know when we caregive for a child, it's a very specific timeline, right? We know when they're born, we know when they're going to be going to kindergarten, we know when they'll be graduating from high school, right? We have these benchmarks. And that's so true with growing older and looking at our parents' trajectory is we don't have any finite dates of here's when a health event is going to occur. Here is when they're going to move out of their home. Here is when death may come, right? We don't know that. But we do know that we are growing older and every year, and that is going to be a part of our future. So I think the first tip that I would have for people is, first of all, we don't self-identify as a caregiver. And when I say that, I mean, we think of ourselves as, I'm a daughter. This is just what I do for mom or grandma. I'm a spouse. This is you support your spouse. I'm a neighbor. I'm a friend. But understanding that if you are caring for someone in any capacity, whether it is in a living situation or even far away or remotely, you are a caregiver. And so when you understand that and can pull that language out, we can then see what resources are available to us, right? So take that identity that there's empowerment in that. There are a lot of us, right? I think the data for family caregiving is there are 53 million unpaid family caregivers. It's about 1 in 5 Americans is a caregiver. We're providing anywhere from, I think it's like 24 hours a week in caregiving duties. And that's when we're not even living with the loved one that we're caring with. So there's a lot of time and money and investment. So we know what's coming, and the opportunity to prepare for that is, I would say, time is on your side, right? So I always think of it as, having conversation when your parents are even in their 50s or 60s, before retirements come, possibly before any health events have happened, and asking questions about, hey, I was thinking about so-and-so, I love using story, right? Because I think we connect to that. So, even I was talking to my friend and her parents are thinking about moving to this community someday. What do you think about that? Do you want to stay in your home? Are you thinking about, gosh, it'd be really great to move where we can be supported with our meals or whatnot? Just getting an understanding of what are people in our life thinking that they would like to have those later years look like. Yes. I think it also gives us an understanding of, do our parents have a plan that includes us? Our mom and dad thinking, I'm going to move in with my daughter and you're going to take care of me. I would want to know if I was a part of that plan. And understanding, Mom, I'm putting a will in place for my kids and our family. Where is yours? Or what have you got in place that, so if something were to happen, I'd know where to find it. I think it's having open conversation, not in crisis and not in chaos, so that you can start understanding the landscape of what planning maybe they've already done, or as a team, what you can look at together. What care management do we have in place? Understanding what documents, really looking at knowing the care team that they use so that you can be supportive of what their healthcare wishes are. So it is all about asking those questions. And I kind of define it as, okay, we've got these pillars of support, right? And looking at it in the lens of what potential hands-on care might be needed and in what setting, what legal documents and financial documents need to be in place, what tools and technology can we implement to support their independence, and then really understanding what their desire is so we can support their purpose and having them live out those later years as successfully as possible with as much autonomy, right? Not only maybe that physical independence, but the autonomy in, I want to make decisions for myself that I feel really good about. And when we do that, when we're not in distress, it only gives us more opportunity to put things in place, to plan ahead, and then to be able to follow through with that and be successful in that.
Wow. I love the planning ahead, Donna, that Nicole really lays out there. And I know that it isn't always a smooth trajectory of saying, hey, here's event one that happens, and now we know the whole family's on board. We're going to start taking these steps. It's not even retirement or Medicare or whatever the case may be, but it'd be great if it was. But in the healthcare world, Donna, I've noticed that I don't see a parent going to the medical visits by themselves any longer. They're not going to the grocery store or picking up their medications by themselves. Someone else in the family is doing so. There's just less out of the house activity that's starting to happen. It seems like it's a real indicator that things are going in a different direction for them, right? The rest of their lives.
Yeah.
What have you done, Donna, when it's come to medication management and trying to help some of those family members recognize now they've got a new role? Like there's mom's just not taking her pills. Like now you're part of that medication journey and you have to take a deeper understanding, or someone does, to be able to help mom. Like what's your thoughts on that stage?
Yeah. So, and I was thinking about this too, where I want to back up a little bit of having those conversations. And I know peers that their parents are so private that they don't even allow them to see what meds they're on or what's going on. And then all of a sudden, like, they're like, what is this? So, and it's kind of surprising to me because I've been kind of the caregiver overseeing my parents' medications for many, many years. So to hear that was really interesting for me. So when people all of a sudden do have to take that on and then they see this list, they're just like, wait a minute, where's all this from? Who do you see? How many people are prescribing? So I love, Nicole, that you've said, if you can get those notes kind of ahead, start preparing, know what's going on somewhat in regards to the health of your parents, if at all possible, if they're allowing for that. And I love your whole story idea behind it too. That's fabulous. I think another thing that I find is peers and people who have actually connected with me and just said, I need someone to look at this. I need someone to help me understand these medications. And I've been saying to my loved one, we need somebody else's perspective here. We need a pharmacist. We need someone else to look at this. So sometimes it's the caregiver trying to win over the parent as well as to, will you allow me to have somebody take a look at this?
Right.
Can we invite this person into our world here for an hour or a couple hours to go through everything and help us make sense of these meds and what's still needed and what's still necessary? And then after that, like even getting to that, or trying to break down those barriers. Then there's the barrier of, look, here's this, and this. You may not need this. You may not need that. I think you should talk to your doctors or, prescribers about these various things. And then that's a whole nother barrier to overcome. So there's a lot of steps that need to be taken. And it's not just one barrier, there's multiple barriers to conquer. And we're just talking about medicine. We're not even talking about the health vaccine and all that. Like, how many times have I been asked, who are you? We can't talk to you. Are you the healthcare proxy? I'm like, I'm on every single call list, form, whatever. It's like, you cannot be challenged for that anymore, other than, oh, you're Donna. Okay. Like, but that has taken years to happen. So that's a challenge too. And these are just the small little victories that we have to get through in order to really be able to help. So, Kevin, I hope I might have answered your question. Just helping people say, you got to do this, you got to do that, and what about your drug coverage? Have you thought about that? Like, there are all these things that need to be thought about. So, so I guess my question back to Nicole, if you don't mind, what do you hear from caregivers? What are your big things, especially on the medication side, or like healthcare side, if you will, versus all these many other things we need to address with our older adults? But what do you hear? What are the big things that caregivers are struggling with?
Yeah, I love this question. And I'm so thankful we're having this conversation, because I think it brings awareness and understanding about maybe some of the misconceptions that we have when we're family members trying to navigate medication. How do we communicate with, pharmacists? I think one thing I've noticed is the misconception that clinicians or pharmacists don't have the time or bandwidth to give us those detailed conversations or insight into the medication care plan. And while we know, yes, you guys are incredibly busy and have a lot going on, but your desire is you want the best outcomes for your patients. And so through my work and having conversations with you, Donna, and with Dr. Delon Canterbury in the past, is the understanding of, we want to be that support system for families and patients. So I think these conversations also give families the permission to, I will make that consultation appointment. They actually can help me with all of this. I've followed up with my pharmacist and, have pulled her aside, and we've had really good conversation. I never thought I could do that before. So that's one thing I hear from families, and in my own experience. I think too, families are asking each other about medications, which I find very interesting. And obviously, while we all have our own experience, it makes me a little, not concerned is the right word, but being able to direct people to the experts that know about the medication and the side effects, and specific to your loved one's health history. I think there's so much to consider. So while I know that the caregivers are sharing with each other, different things and how to use medication and all of that, a lot of it can be helpful in terms of general systems or what works and how to get your loved one to take medication. But I think asking about specific medications and benefits and side effects always is best coming from the pharmacist. So encouraging families to go that route. I think for families, for having the understanding of that they're a valued part of the care team. I know we're moving more in that direction, but they want to know what's happening and what changes are taking place in the medications, and understanding why the medication was prescribed. Medications deeply impact caregiving when you think about it, right? Some side effects are using the restroom or affecting our bodily functions, our cognition, right? All of these changes that will affect how we show up as a caregiver. So knowing all of those details in a way that we can easily understand it. So that is a huge question. And then, how do we monitor medication changes and the response from our loved one? Are there any best practices on how we distribute medication, right? And have that oversight to it. I think another piece that I hear from families is, wanting to understand, and Donna, we had talked about this in our podcast, which will come out soon, is that whole looking at deprescribing and the amount of medications and how our bodies change over time as we age. So I know that for me in the past, 10 years is a newer school of thought. And when I say that, I mean, we would have care conferences where we'd do medication reviews, and obviously we'd want to not have our loved one or even the people we're caring for on multiple medications without having those specific reasons. But really looking at it further, I think has been beneficial for families and for the community. So just that awareness around how do we do that? And then I think families want support with the financial aspect. Like, can there be help with navigating? How do we find coverage? Are there benefits that I'm missing out on, or different guidance on how we reduce medication cost? Because a lot of families are out of their own pocket financially contributing to the care of their loved ones. So how do we optimize that? I'll stop there if you guys have any further thoughts on that. But yeah.
I love the their own pockets piece, Nicole, because I remember reading some studies of late. They were showing, and actually this one was from a couple of years ago, but somewhere around 26% of someone's income as a caregiver goes toward their caregiving responsibilities. Right. Over a quarter of their income is going toward taking care of mom and dad, or grandma and grandpa, or aunt and uncle, whatever the case may be. That's significant. And I think that you mentioning the fact that medications can play a significant role in that process, it really leads us to, I think, a few questions during this initial phase of life is getting an understanding of what is your role in your caregiver, the individual you're taking care of, what medications they have. Do you understand them? Do you understand the care pathway and plans? Essential, right? In general, of making these decisions, knowing how to deprescribe or getting them onto an optimal regimen. That's a heavy, deep conversation for a lot of people to even comprehend, during that first phase without the right individuals on touch points. But one that I think hits you more quickly than another is when you recognize how expensive medications can be for our older adults and how many may be on board. Do you have any anecdotes, Nicole, related to that on just cost management and recognizing where resources are when it comes to containing those costs or decreasing those costs in general?
Yeah. Oh, that's a big question. It's so individualized, right? But I think that having an understanding of when we can clarify, working with our pharmacist on what medications are absolutely necessary, right? Looking at cost, weighing out quality of life, right? Is this helping maintain my independence, my happiness, my health long term? Or is this something that I've been on for 20 years and I've just never been off of it, right? So looking at that, getting clear with resources, that is so, I think we're all trying to navigate that, specifically with the Alzheimer's diagnosis and the length of time, right? That is a diagnosis that goes on for many, many years. And being able to call the Alzheimer's Association and ask, they have a 24-hour helpline, right? And so asking questions on navigating some of those questions we might have around medication. I don't know if I found a specific resource that dives into that question specifically, which now I'm going to need to do a little digging, like how do we optimize cost with medication, and where do we go for that? I mean, I think that's a huge need. And when you were talking about the statistics, it's like nearly 80% of all caregivers are using their out-of-pocket, you know, they are having those out-of-pocket expenses for their loved ones. That is significant. And a lot of caregivers are working caregivers. And I think the number is like 60% of working caregivers are missing hours at work and are having to make work accommodations for their caregiving. So not only are they spending money out of pocket, they're also missing and not optimizing those work opportunities that will further, you know, their financial growth in the future. So there's a lot of frustration and complexity when we're navigating that. So I don't know if I fully answered your question with that, but I know that families are making choice. They're sacrificing in parts of their life to be able to then pay for those medications that are life-saving and, out of necessity. So, in a perfect world, we don't want anyone to be sacrificing in one way or the other, especially as we're growing older, but they're needing to make those decisions based on not having the financial resources to support that. So I think getting help and guidance with that of how we can be supported. This is kind of off subject, but not. I was at the dermatologist and needed something for my skin, and thankfully my doctor walked through with me and said, actually, if you use this program and sign up for this discount and go to this pharmacy, this will save you. It was like $100 or something. I never would have known that, but she graciously took the time to walk me through that. So, if we can have our clinicians be mindful of that, our pharmacists give some insight into that for families, I think it would go so far. Yeah.
So if I could just jump in for a minute, just because I spent a lot of years in an outreach program at Mass College of Pharmacy, at the pharmacy outreach program, and learned a lot in this whole world of affordability of meds. So one thing is to check your Medicare Part D plans every year, because they change, deductibles change, and premiums change, and what's covered changes. But there's also extra help through Social Security that a lot of folks might not think that they qualify for, but they might. So there's a couple of different levels of that. So extra help through Social Security. You can Google it and things would come up. You can also look for state pharmacy assistance programs. Massachusetts has a wonderful one called Prescription Advantage. Not every state has them, but some do, and some specialize in certain meds or certain disease states. But one very helpful website that people can also use is called Needy Meds. And you can go into Needy Meds and you can actually either look up a drug or look up a disease state. And there's all different sorts of foundations and information in Needy Meds that you're able to get help with insurance, get help with co-payments, get help with transportation, needs for particular disease states. So there's a lot of resources out there that are available. So I would highly recommend any one of those types of websites and help.
I love it. I'm going to use those now when I talk specific to medication, right? I think that's a huge help. There's a platform called Iana Care for family caregivers, and a part of that platform is, care coordination and coverage and bringing those teams together. But there's also that medication management, right? Like keeping track of all of what's happening, those current medication regimens, and it gets families on the same page. It also has different financial and legal considerations, guidance around all of that document. And then another platform, it's a mobile app called Primary Record. And it is an app that equips families with their medical records all in one place. And I've happened to know the founder, and she is wonderful. And I think we're moving in the direction of what, like you said, right? Even having access to mom's medication lists, like how do we get that? All of that. We're moving in that direction where data is going to be comprehensive and in a location that those care teams can access, so we can provide that optimal care. So it's so exciting to see the innovation that's happening that is able to bring people together. Yeah,
for sure.
I love it. Yeah, I think there's one thing you said was really interesting about your dermatologist visit there, and that they walked in and they just had some inside information for you that you wouldn't have known, right? There's a great study that just came out recently that there was a group of providers, and all the institution did was they literally posted the cost of laboratory testing on their monitors, right? When they would order a lab test, it would pop up. Lab test costs dropped dramatically because the providers were aware of how much this was going to cost their patients. And the number of test orders dropped significantly. And it's really interesting how that disconnect, that we're seeing between care provider and recognizing the cost to their patients can be an issue. So now I'm speaking, I guess, to our clinician audience to a certain extent, but also to the caregivers out there. Great question to ask. When you're in that caregiving setting, when you're inside of that appointment and or at the pharmacy counter, recognizing that cost is a barrier to care. And your team doesn't want to give a prescription out and you look at it and go, I'm going to have to take these pills every fourth day because that's how I can afford it. Like that's not the goal for anybody, right? And I think having those very realistic conversations of, can I use a discount card? Can I find an assistance program? Is there something that's related to a charitable organization in my area? Is there a charitable pharmacy that's available or a cost-only pharmacy? Whatever the case may be, I think can be really beneficial. Exact same thing in the primary care world, the laboratory spaces of being able to find things that are much less costly, like the direct primary care route, that we're seeing a huge cost savings compared to typical care. So really good conversations, I think, to have and to encourage a lot of our caregivers out there and patient population that's listening, and also to those clinicians out there to recognize that cost is a massive barrier. We want to provide the best care to our patients. And as soon as they leave our door, they're thinking, can I afford to buy my groceries? That's not a burden that we want to place on their shoulders without at least having that conversation that needs to be important.
Right.
I think what's also important too is that not every doctor or office is going to know, right? Until maybe somebody goes to the pharmacy and they don't necessarily know if you have a deductible that still needs to be covered and you have to pay $300 for that medication until the next time when your co-payments actually kick in. So there are things like that. And people don't understand those deductibles for either. So I think what happens too, in what I encourage people to, and what I tell them is, make certain you have that communication with your doctor or whoever is prescribing, because they might not know that, and they don't want you having to spend that much money. So if that's the case, open up that communication. I think that's another thing too, that some people take pride in, like, oh, I can't trouble my prescriber with my finances. That's not up to them. So I got to figure out a way, or I'm just not going to take it, or whatever it might be, when there could be very easily a different alternative that might be effective and less expensive. So I think that it's important that we have all of these communications open between providers and caregivers, and not to be afraid to mention these issues. There could be options out there.
Right. Yes. Thank you for saying that and encouraging caregivers to have the communication, right, and ask the question. I know it's done so much for me and the caregivers that I've been able to mentor is saying that this is someone that is a part of that care team that can be an asset to you, that you can ask those questions. And so hearing from you that's encouraged well is a wonderful gift to caregivers. There's, when you were talking about the transparency of cost, there's a conversation happening in the senior living world about that, that having the transparency of prices, right? Price transparency, and understanding what that looks like and where different organizations are at, and what is the value served with the price attached to that, is definitely, I think, important. It gives not only the operators and providers or clinicians an understanding of the landscape of what's happening, but also it gives families the option to have choice, right? And I think I never really realized the different costs between the different pharmacies, or even, right, hospitals, primary care, if they're not a nonprofit, right? So it's a business, understandably. So it is an important conversation to have. I think it gives people information that is valuable.
Huge. No, I love that, Nicole. And I think the one question I had for you, just our kind of last wrap up section here, because this has absolutely flown by. I mean, you have just so much knowledge, Nicole. I really appreciate that. But with this last question is really the tie-in for that next stage, right? We go from, we hopefully have the planning, right? We have the planning conversation. Yes, caregiver, family member of mine, I do want you to be involved. This is what the level of care I'd like. We are checking on those medications, getting things optimized as much as possible. The next one is when the decision starts to shift, Nicole, and your advice to people when it goes from mom or dad. I'm just going to use that as an example. Who were before, mom or dad, they're very active in their care. They're making their own choices. And then all of a sudden it shifts toward you as the caregiver, right? They're saying now it's your responsibility to make these decisions. What have you run across there, Nicole, when it comes, especially, I mean, the show is called The Med List, when it comes to medication management and that burden on their shoulders, how to take that off and how to help the care team, the clinical care team, also take care of those caregivers during that transition that's difficult for everyone.
Yeah. Oh my word. That's a huge part of caregiving. A major part of caregiving is managing medications for our loved ones. And I think when that shift happens, prior to that, if possible, when we talked about the documents, getting those power of attorneys in place, I think it gives you as the caregiver an option to then have oversight over that, the medical care, the care plan, the medications, having access to it, right? If we're administering it and we're managing that, it's important that we are able to have access to everything that we need. And we can really only do that if we're legally able to have access to that. I think my call to clinicians would be, when you're having conversation with the caregivers, just the recognition of, I know that this is a lot for you. You're managing care for someone, and letting them know that they are supported. A lot of caregiving, it's emotional, right? There's a toll, not only emotionally, physically, there's a toll as we're caring for people. And there is the mental burden and load that we carry now for our loved one that we're responsible for. Yes. So I think that understanding that emotional journey, being supportive, knowing how important that family member is to that care team, and that they are valued, and that the clinician wants to know what the loved one is thinking and what's happening, and being a part of monitoring some of those changes. There are different tools that work for different people, right? As caregivers, some people really like, and depending on your loved one's diagnosis, I guess, right, is going to change how that medication administration happens, where they're stored, who's doing that, right? There's just so many caveats to that. So, but broadly speaking, is find the system that works for you, that gives you the most peace of mind, that is safe for your loved one, that can be in a way that is shared with the care team, and that you have access to the up-to-date medical care medication. and really work with that provider as they are wanting to be supportive. And if they're not, from the family member, find the people that are, right? Find your team. You don't have to be stuck with that one provider that might not see how important it is to support family caregivers. That, find someone that does want to be a valuable part of your team.
Yeah.
Beautiful. I love that.
There's and this is something that I think is a thread that we've seen throughout this conversation too, is as providers and clinicians, when that person that is your patient shows up with that caregiver person, right? You've got to start paying attention. There's been a change if there's that shift. So as much as it is for caregivers to notice that change too, the providers too, and pharmacists, whoever you might be, we also need to pay attention to that and make certain that we're wondering what's changed, what's gone on.
Right.
Why is this a shift in the person's care?
Yeah, that's so true. It is a change in medications often and not adhering. And it is also a change, a lot of financial planners will say. I just had a conversation the other day where a missed bill and not making the right decisions financially, those are two roles that are really vital in an understanding of there's been a shift and now we need to have some things in place to support mom or dad in ways that we may have not had to before, but now is the time. Yeah.
Wow. I don't think we can end it on any better note than that. Now is the time. I think that's what our whole conversation has been about, that we can really find some great time to plan, to prepare for some of the shifts and changes that are going to occur, and to get some alignment with our care team, in general. Hey, and that care team includes a very important expanding role of caregivers, and recognizing that the way our healthcare system is shifting and changing, we're starting to put more pressure on your family to take care of you. And vice versa, your family members are going to need that assistance. So being more prepared and having less burden dropped on you is a massive deal. And Nicole, thank you so much for your time. You're just absolutely wonderful to have on. And I hope the audience, I know they did, enjoyed all of your wisdom to be able to drop there. Donna, I'll pass the mic to you to close us out, though.
No, thank you, Nicole. Wonderful to have you. And I know we have so much more to talk about. So hopefully we can do this again.
I love it. Thank you. Thank you for having me. Great questions. Loved our conversation. I appreciate it. Thank you.
Awesome.